But I think maybe a lot of us over prepare trying to memorize all these crazy details about stuff.
That could be true, but like you mentioned yourself, Grant, we achieve, we're trying to achieve high merits and high honors. So, we want to do UIC proud when we walk in there. But I think the people who, it'd be interesting. Maybe we could talk about the pass rate then, because I would imagine that it's almost like some people go into this with maybe a correct mindset and, they dedicate enough time. And I think the pass rate this year was like 77%. In the past, it's been anywhere from like, I think as low as like 60 to, I think there's a year it bumped up towards like 90. But I would imagine that some people, I think, walk into the exam and they kind of have, they haven't really prepared in a way that, in order to articulate, all that knowledge you have during residency or mentioning, it's almost like developing a new skill. You do have the knowledge, you've seen all this stuff, especially, we're lucky coming from UIC, but in order to, if somebody asked you just like blank, what is diabetes, unless you like maybe practice that or, all of us obviously as, oral surgery graduates know what it is, but to articulate it in a sentence so that you don't, you don't waste part of your like, 12 minutes for that little topic or section, then it can be very difficult. It definitely takes practice. And I think maybe that's the next thing to emphasize